One-third of my practice is revisional surgery. These are patients who've had surgery somewhere else and have had some sort of complication because of those surgeries, and they come and see me for help.
I had surgery on January 15th of 2007 to fix a scar on my forehead that I got when I was 2 years old. It happened to be right in the middle of my forehead, where I also had frown lines that were getting worse and worse as I got older. And I started becoming self-conscious about it, and it was always something that I wanted to fix. Part of the procedure the initial doctor did, he went in through my eyelids to get to the scar tissue in my forehead and to release the brow muscles. But what happened was somehow my right eyelid was damaged. I didn't know it was damaged initially. I had a lot of swelling and both my eyes were closed for the first 2 days, swollen shut. After about a week, one eye was healing and the other eye wasn't. I really didn't know something was wrong until about 2 weeks out after all the swelling had gone, and I didn't have function to my right eye. It was halfway open, so basically it was droopy on one side, and when I looked up, it didn't follow with my eye, so I had no vision above eye level. The initial surgeon thought he knew what was wrong. He thought it was scar tissue that was sticking together. He thought it was this, he thought it was that. Trusting him and thinking he was the man for the job, I went back in for surgery again with him, and unfortunately it only made it worse. After I knew that had made it worse, I started searching, started looking for answers, because at that point I knew that there was a breakdown in care and I wasn't getting the treatment I needed, so I knew it was up to me to find myself help. And then I started searching for specialists, people that take care of people born with this problem, people that take care of trauma patients with this problem. And I found out that there were very few surgeons that did that, and Dr. Parsa happened to be one of them.
Lori's case, I knew that what the anatomical problem was just from listening to her history and doing the exam, and I had to reassure her that this is something that we can fix. I talked to her about other patients. I think another problem is patients like this feel like they're alone. They feel that there's no help for them. I explained everything to her and I reassured her that this is something that we're going to take care of.
For the first time, I found someone that cared, that wanted to help me, and he put his ego aside, and I knew that. I felt that I was in good hands right away. And he was the first person, when he explained things to me, that they made sense. That it made sense of what was wrong or what could be wrong, that it was a physiological problem, that it wasn't just, you know, things sticking to each other. It was that actually the muscle was detached and it wasn't working and it needed to be reconnected. But at least, like, for the first time, I had an answer.
The main problem was when we open, every time someone else has been there, there's a lot of scarring that forms. So we had to go in, and it makes it, that's why revisional surgery is always a little bit more challenging than primary surgery. So we went in, and it took some time to really identify the tissue because there's so much scar tissue. Once we identified the tendon that I was telling you about, the ligament, we reattached it, and that was it, and we put it back together, and I knew, once I identified it, I knew she was gonna do great.
Waking up from surgery and being able to move my eyelid for the first time in months, it was bizarre, and it was like something I would never think I would be jumping for joy for, but it was like, I mean, I remember afterward I was just like, thank you, thank you.
She's doing fantastic. I think doing revisional surgery is very gratifying, because these are people who feel very helpless. I think every patient that comes to my office, we treat them like family and they become part of the family. So it's very important to kind of make them feel comfortable. Every person is nervous. I think it is a privilege really for us to have that right to take care of someone. They trust you with what problems they have. It really is a privilege, and so I put that in a very high priority, and to me, my family, friends, and my patients are in that same level.
He did an incredible job helping me He exceeded my expectations. I was hoping for 50–60% recovery. I would have been happy, not happy with that, but I would have accepted it. Even when we were talking, he, set me up that, this is what you can expect. We may be able to achieve it, we may not, but he blew my expectations out of the water, and I have, I would say, 100% recovery of my eyelid. It sounds corny, but I can look up and I can see the stars, or I can look up and I can see, the trees or anything, or when I'm driving, I can look up and see an address on a building. It's been about a year, and I don't really think about it anymore, and that is the best feeling.